The Canadian Medical Association has your own proposal to make it easier to move provinces.
Absolutely. So we know as well with what's going on in the US, there's been lots of talk about reducing interprovincial trade barriers and interprovincial labor mobility. And we'd like to see physicians be able to move from province to province without having to apply for a new license, going through that paperwork, paying thousands of dollars. Because then, if like you have right now, some emergency rooms that are closing down for a short period of time, maybe there's a Calgary doctor who has the weekend available and could come out, but they're not
Mm.
going to pay thousands of dollars to help out for a weekend. They might come though if their license was just recognized.
Mm.
So this is another solution that we want to see and that the Atlantic provinces are already doing. Right now, you can pay an extra $500 and you can work in any of those four provinces on an ongoing basis.
Okay.
So there are possible solutions that we can do in many different areas at the same time.
What then do you make of this proposal to try and attract more healthcare professionals from the United States as they say, well, President Donald Trump is making changes to the healthcare system there. It may be more attractive for them to come up here.
Well, I don't think this is an either or question. I think at this point it needs to be an and.
Hmm.
So I agree with all the callers. We need to increase our class sizes. Now, the average family physician has 10 years of post-secondary education. They have 4 years of medical school, 2 years of residency. That's not a quick solution to increase our numbers, but it is a solution we need to be doing at the same time. So we need to be making sure that those physicians who are already in Canada and have licenses from other countries, but maybe not recognized here, we need to make sure that they're being integrated into our system at the same time. We need to be using things like physician assistants to try to decrease the amount of work that physicians have to do and bring in a whole team-based approach so that if you go to your primary care doctor, that maybe you're going to see a dietitian or a physiotherapist who works together with the pharmacist and the nurse practitioner and the doctor and provides care all at the same place, sharing a health record. All of these solutions are important. We need to invest in the communities so people have home care or long-term care facilities that they can go to when they need some extra support and don't need a hospital bed, but do need more support.